Good morning. My name is Brenda Journey. I started my journey. Well, I had cancer twice, and then because of the side effect of the treatments, I developed lymphedema in my upper limb arm in the left side. So I had it for maybe 2 years or 3. At the beginning I didn't, and then it started developing, and my arm started getting bigger.
And I was very unhappy with the look of it, and it was uncomfortable. I had to wear compression sleeves, and they're very, very uncomfortable, and I couldn't wear them all day long, and because then they would just make me feel even worse. I had to, which I still do today, physiotherapy, but physiotherapy, massage, but physiotherapy is expensive. So imagine if you have to do that for the rest of your life, it's not going to be a good business. And also I wanted quality of life, and I wanted to go back to my life normally. So I started thinking about this surgery, which I didn't even know this surgery can be done before. And then even my physiotherapy started, she told me that, there are some places in the world that are doing these surgeries. And when I went back to my country in Argentina for my breast reconstruction after the cancer, my plastic surgeon in Argentina, he told me about this surgery. He's trying to introduce it in Argentina as well himself, but he did say there are a few experts around the world, and he said, if you have the chance, please go ahead and do it with these experts, because it's much better. And so one of the doctors he mentioned was Dr. Chen. And so I started researching, and together with my husband and together with my father, who is a doctor himself as well. So that was a lot of help. And so we research a lot, and we communicate with doctors' assistants, with Dr. Chen's assistants, and we set up a meeting by video call, which was very convenient, so I can, explain and I can have feedback. So that was the first step. And then, after a few months thinking about it, we decided, since I had some time in my hands, so we decided to come to Taiwan and try the surgery. So we came to Taiwan on the 1st of December, and on the 2nd of December I met with Dr. Chen and all the medical team. They did a lot of tests because Dr. Chen needed to see what was the situation inside my arm, so he can take a decision of what kind of surgery will be better for me, more beneficial. So there were 2 options. One was anastomosis, and the other one was lymph node transfer. In my case, it had to be the harder one, which was lymph node transfer, but the doctor was more confident that it will make it work much better than if he does the anastomosis. So, and what I appreciate is the honesty of the doctor of explaining everything and telling me exactly what he thinks and what is it gonna work better for me. So it was not easy. It was difficult for me to take the decision to do the surgery because it was a big surgery. I will have, so Dr. Chen will take lymph nodes from my neck, which actually I was happy about it because I had heard that sometimes they take lymph nodes from the ankle or the leg, and then maybe there is a possibility that my leg will start swelling, and of course I didn't want a new problem. So when he told me he'd take them from the neck and then there is no side effects for that, then I was happy, although I was very concerned as a woman that I would have a scar here, like almost in my face. But he explained it will be like in between the face and the neck, so it will not be that visible. It will be quite hidden, which is it is. So I have it right now, and I can't even notice myself. Another one of the little side effects is when they touch here, they touch a lot of nerves, and maybe my lip will start twitching a little bit, but that is normal and it will recover within 3 months. So as you see me today, I had surgery only 10-12 days ago, and I'm doing great. So this I can't even notice anymore, and it's only been 10 days, so it will just only improve. My other bigger concern was the scar in my arm, because he will take the lymph nodes and fat and skin from here, and he will put it in here, and I will have a little bump, a little ball in here. And I was, of course, again, as a woman, very concerned about that thing here in my hand. But I had to make peace with it. And of course, the doctor said, please think about it. And the decision was always mine. And I started thinking, okay, if I don't do the surgery, I don't have all these scars. But then the arm will just keep progressing, the lymphedema. And then I could end up with a deformity, which I didn't know. I didn't want it. So finally I made peace and I took the decision and we had the surgery. So the journey of my surgery, it was difficult, especially the first 8 days, because I was in ICU. I think it was for 8 days. That was the hardest thing for me to do. I am a person that am very active usually. And I like to do a lot of things with my hands all the time and move around all the time and walk around all the time. So that was hard to go through because I had to be in the ICU for 8 days, hooked to many wires and to the bed, and I couldn't move around. So that was difficult, but I managed and I tried to do some things. Christmas is coming, so I was organizing my Christmas dinner, and that helped me mentally to go through it.